friends, welcome once again to our channel. My name is Leo. I'm happy that you are here watching this video, and this is gonna be another of those type of videos in which I tell you something interesting. I'm gonna continue doing role plays. It's just that this time I wanted to bring you something different, something that because I always do role plays, so I kind of wanted to do something different. I hope you enjoy it, and of course, I will continue making role plays. In this video, I'm gonna talk about interesting or important medical advancements in history, and I hope you enjoy this one. Let's go ahead and start with the first one. So the first one is going to be vaccination. The development of vaccines has significantly reduced the burden of infectious diseases worldwide. Milestones include the smallpox vaccine by Edward Jenner in 1796, which led to the eradication of smallpox, and the development of vaccines for diseases such as polio, measles, and influenza, which have saved millions of lives. The discovery of vaccination is credited to Edward Jenner, an English physician in the late 18th century. In 1796, Jenner observed that milkmaids who had contracted cowpox, a disease similar to smallpox but much milder, seemed to be immune to smallpox. Based on this observation, Jenner conducted an experiment where he inoculated a young boy with material from a cowpox sore and later exposed him to smallpox, finding that the boy did not develop the disease. I think that was at the moment or later on called controversial because of the way that physician conducted the experiment. I don't know, I kind of remember something like reading something like that. Okay, let's continue. This groundbreaking discovery laid the foundation for the development of vaccines. Vaccination works by exposing the body to a weakened or killed form of a disease-causing agent, such as virus or bacterium, triggering the immune system to produce antibodies without causing the actual disease. This prepares the immune system to recognize and fight off the real pathogen if the person is exposed to it in the future. Jenner's work marked the beginning of modern vaccination, which has saved countless lives and helped eradicate diseases such as smallpox. Today, vaccines are critical for public health, preventing the spread of infectious diseases and protecting individuals and communities from serious illnesses. Now we're going to talk about antibiotics. The discovery of antibiotics revolutionized the treatment of bacterial infections and dramatically reduced mortality rates from infectious diseases. Alexander Fleming's discovery of penicillin in 1928 paved the way for the development of numerous other antibiotics, transforming the practice of medicine. The discovery of antibiotics is attributed to Alexander Fleming, a Scottish biologist and pharmacologist. In 1928, Fleming made this discovery somewhat serendipitously while conducting research on Staphylococcus bacteria at St. Mary's Hospital in London. One day, Fleming returned to his laboratory after vaccination and noticed a petri dish containing Staphylococcus bacteria had been contaminated with mold. To his surprise, he observed that the area around the mold, Penicillium notatum, was clear of bacteria, suggesting that the mold use of anesthesia was not a single discovery, but rather the result of incremental advancements in experiments by various researchers over time. In the early 19th century, scientists and physicians began experimenting with different substances to induce unconscious and alleviate pain during surgery. One notable breakthrough came in 1846 when Dr. William T.G. Morton successfully demonstrated the use of ether as an anesthetic during a surgical procedure at the Massachusetts General Hospital in Boston. This event is often cited as the first public demonstration of surgical anesthesia. Ether anesthesia quickly gained acceptance and was widely adopted for surgical procedures, transforming the practice of surgery by making it safer and more humane. Other substances such as chloroform were also used as anesthetics during this time. The discovery of anesthesia marked a significant milestone in medical history, allowing surgeons to perform complex procedures without the patient experiencing pain or distress. It paved the way for modern surgical techniques and laid the foundation for the development of safer and more effective anesthetic agents. Today, anesthesia plays a crucial role in medicine, enabling a wide range of surgical procedures to be performed with minimal discomfort and risk to the patient. Now, we are giving to number 4, which is sanitation and hygiene. Improved sanitation and hygiene practices including clean water supply, sewage system, and hygiene have played a crucial role in preventing infectious diseases and extending life expectancy. The implementation of public health measures such as vaccination campaigns and sanitation initiatives has had a profound impact on population health. The advancement of sanitation and hygiene has had a profound impact on public health throughout history. There are some key developments and their impacts. Clean water supply. Access to clean water. Access to clean drinking water is essential for preventing waterborne diseases. The development of water treatment and distribution systems, such as filtration and chlorination, has significantly reduced the incidence of diseases like cholera, typhoid, fever, and dysentery. Clean water also promotes general hygiene such as hand washing and food preparation. Sanitation infrastructure. The introduction of sanitation infrastructure, including sewage systems and wastewater treatment plants, has played a crucial role in preventing the spread of infectious diseases. Proper disposal of human waste reduces contamination of water sources and minimizes the risk of diseases like diarrhea, hepatitis, and parasitic infections. Personal hygiene practices. Education and awareness about personal hygiene practices, such as hand washing with soap, proper sanitation facilities, and menstrual hygiene management, have contributed to reducing the transmission of infectious diseases. These simple yet effective measures help prevent the spread of pathogens and protect individuals scientists such as Louis Pasteur and Robert Koch in the 19th century revolutionized our understanding of infectious diseases. This theory established that microorganisms, such as bacteria and viruses, are the cause of many diseases, leading to advancements in microbiology, disease prevention and treatment. The germ theory of disease revolutionized our understanding of the causes of illness and laid the foundation for modern medicine and public health practices. The theory proposes that many diseases are caused by microorganisms such as bacteria, viruses, fungi, and parasites that invade the body and reproduce, leading to infection and disease. One of the key figures in the development of the germ theory is Louis Pasteur, a French chemist and microbiologist who made several groundbreaking discoveries in the mid-19th century. In the 1860s, Pasteur conducted experiments that demonstrated the role of microorganisms in the fermentation, disproving the theory of spontaneous generation and showing that microorganisms were responsible for the spoilage of food and beverages. Building on Pasteur's work, another important figure in the development of the germ theory is Robert Koch, a German physician and microbiologist. In the late 19th century, Koch formulated a set of postulates known as Koch's postulates, which established criteria for proving that a specific microorganism causes a particular disease. Using these postulates, Koch was able to identify the causative agents of several diseases, including anthrax, tuberculosis, and cholera. The acceptance of the germ theory of disease had profound implications for medicine and public health. It led to the development of antiseptic techniques to prevent the spread of infection during surgery, the use of disinfectants to sterilize medical equipment in facilities, and the development of vaccines to prevent infectious diseases. It also spurred advancements in microbiology and led to the discovery of antibiotics, which revolutionized the treatment of bacterial infections. Overall, the discovery of the germ theory of disease transformed our understanding of the nature of illness and laid the groundwork for the development of modern medical practices aimed at preventing and treating infectious diseases. Medical imaging. The development of medical imaging techniques such as X-rays, MRI, CT scans, and ultrasound has revolutionized the diagnosis and treatment in medicine. These imaging modalities allow healthcare providers to visualize internal structures and functions non-invasively, aiding in the detection and management of various medical conditions. The discovery and development of medical imaging have revolutionized the field of medicine, allowing healthcare professionals to visualize internal structures of the body non-invasively and aiding diagnosis, treatment planning, and monitoring of various medical conditions. There are some key milestones in the history of medical imaging. X-rays. The discovery of X-rays is often attributed to Wilhelm Conrad Röntgen, a German physicist in 1895. While conducting experiments with cathode rays, Röntgen observed that a fluorescent screen in his laboratory emitted light when exposed to mysterious radiation. He called these radiation X-rays as they were initially unknown. Röntgen's discovery led to the development of X-ray imaging, which quickly became a valuable tool in medical diagnostics. Computer tomography or CT. The development of computed tomography safer option for imaging certain parts of the body, such as the brain and spinal cord. MRI is particularly useful for detecting soft tissue abnormalities such as tumors, inflammation. Ultrasound. The use of ultrasound in medicine dates back to the early 20th century, but it wasn't until the mid-20th century that ultrasound technology advanced significantly for medical applications. Ultrasound imaging uses high-frequency sound waves to create real-time images of the body's internal structures. It is commonly used in obstetrics to monitor fetal development during pregnancy, as well as in other medical specialties for imaging organs, blood vessels, and soft tissues. Positron emission tomography (PET). Positron emission tomography or PET imaging was developed in the 1970s. PET scans involve the injection of a radioactive tracer into the body, which emits positrons that are detected by a PET scanner. This imaging technique is used to visualize metabolic and biochemical processes in the body, and is valuable for diagnosing cancer, assessing brain function, and evaluating cardiac health. These advancements in medical imaging have transformed healthcare by providing clinicians with powerful tools for diagnosing and treating a wide range of medical conditions, ultimately improving patient outcomes and quality of care. Now, let's go ahead and talk about organ transplantation. Organ transplantation has saved countless lives by replacing failing organs with healthy ones from donors. The first successful kidney transplant was performed in 1954, followed by advances in heart, liver, lung, and pancreas transplantation. Organ transplantation has improved the quality of life for patients with end-stage organ failure and expanded treatment options for a range of conditions. The discovery and development of organ transplantation has revolutionized medicine, offering life-saving treatments for patients with end-stage organ failure. There are some key milestones in the history of organ transplantation. Early attempts. The concept of organ transplantation dates back to ancient times, with accounts of experimental transplant procedures in animals and humans recorded in ancient Greek and Roman texts. However, these early attempts were largely unsuccessful due to limited understanding of immunology and rejection. The first successful human organ transplant was a kidney transplant performed by Dr. Joseph Murray and his term at Brigham Hospital in Boston in 1954. The recipient was a 23-year-old man with end-stage kidney disease, and the donor was his identical twin brother. The transplant was successful, and the recipient lived for 8 additional years with the transplanted kidney. One of the major challenges in organ transplantation is the risk of rejection, where the recipient's immune system attacks the transplanted organ as a foreign body. The development of immunosuppressive drugs such as cyclosporine, and prednisone in the establishment of organ procurement organization and transplant writing lists, along with protocols for organ allocation based on medical urgency and compatibility, have helped to ensure fair and equitable access to organ transplantation for patients in need. However, organ shortage remains a significant challenge, leading to long waiting times and advocating for increased organ donation awareness. Overall, organ transplantation has transformed the lives of countless patients with end-stage organ failure, offering a chance of extended life and improved quality of life. Ongoing research and advancement in transplantation science continue to push the boundaries of what is possible in this life-saving field. Good. Now, let's continue with advance number 8, genomic medicine. The mapping of the human genome and advances in genomics have transformed our understanding of genetics, disease mechanisms, and personalized medicine. Genomic technologies enable the identification of genetic variations associated with diseases, facilitating targeted therapies, precision diagnostics, and risk prediction. The field of genomic medicine encompasses the use of genomic information, particularly the analysis of an individual's DNA sequence to guide medical decision-making, diagnosis, and treatment of diseases. Here are some key milestones in the discovery and development of genomic medicine. Human Genome Project. One of the most significant milestones in genomic medicine was the completion of the Human Genome Project in 2003. This international research effort aimed to sequence and map the entire human genome, providing a comprehensive blueprint of human genetic information. The HGP laid the foundation for subsequent research in genomics and personalized medicine. It's training a lot here. The development of high-throughput DNA sequencing technologies such as next-generation sequencing has revolutionized the field of genomics by enabling rapid and cost-effective sequencing of entire genomes. These technological advancements have made it possible to analyze genetic variations and identify disease-causing mutations with greater precision and accuracy. The mapping of the human genome has facilitated the identification of genes associated with various diseases, including cancer, cardiovascular disorders, neurodegenerative diseases, and rare genetic disorders. By understanding the genetic basis of diseases, researchers can develop targeted therapies and personalized treatment strategies tailored to individual patients' genetic profiles. Pharmacogenomics is the study of how an individual's genetic makeup influences their response to drugs. By analyzing genetic variations that affect drug metabolism, efficacy, and toxicity, pharmacogenomics aims to optimize drugs therapy and minimize adverse effects. This personalized approach to medication management has the potential to improve patient outcomes and reduce healthcare costs. Precision medicine initiatives, governments, academic institutions, and healthcare organizations worldwide have launched precision medicine initiatives aimed at integrating genomic information into clinical practice. These initiatives seek to accelerate the translation of genomic discoveries into actionable insights for patients, care, promote disciplinary collaboration, and address ethical, legal, and social implications of genomic medicine. Now, we're gonna go with advancement number 9, and it's raining a lot, but hope it doesn't sound too bad. Cardiovascular interventions. Innovations in cardiovascular interventions such as coronary artery bypass surgery, angioplasty, and stent placement have significantly improved outcomes for patients with heart disease. These interventions restore blood flow to the heart, reduce symptoms, and prevent complications, contributing to the decline in cardiovascular mortality rates. And the last one, advancement number 10, is public health measures. Public health initiatives including disease surveillance, health education, and preventive interventions have had profound impact on population health. Efforts such as tobacco control, immunization programs, and screening for cancer and chronic diseases have helped reduce the burden of preventable illnesses and promote health and well-being. And there you have it, guys. 10 important advancements in medicine, I will say, in recent history. So I hope you liked the video. I hope you find this video relaxing. I'm not a doctor, as you know. I'm just here to give you a ASMR to help you relax. And it started raining at the end of the video, so I hope it doesn't sound too bad. If you like the video, remember to please subscribe, leave me a comment and a like. I would really appreciate it. If you have a suggestion for the channel, please go ahead and leave it in the comments, because I feel like I'm getting short on content for you guys. And I don't know, thanks a lot for watching. And remember, I will continue making roleplays, but I will combine with this type of videos